Morning. Thank you for being here. My name is Irving Gold. I'm the CEO of the Canadian Association of Occupational Therapists. We represent more than 20,000 occupational therapists, assistants, and students working on the front lines of healthcare. I want to begin with a letter a family received from Indigenous Services Canada. It explains that their request had been denied, but then the denial was overturned for one part of their request while another was upheld, and justifies their decision based on whether supports meet the normative standard of care. Normative for who? Now imagine navigating that confusion when the stakes are your child's health, safety, and well-being. I want to talk about Maya for a moment, an 8-year-old who cannot bathe safely without a custom bath chair. Her occupational therapist assessed the risk, documented the need, and submitted the request months ago, exactly as the system requires. And it's still sitting in a federal queue. Maya keeps growing and the bathtub does not. To keep Maya safe, her occupational therapist put her own money on the line, effectively giving the federal government an interest-free loan while waiting for reimbursement. A simple, essential piece of equipment installed in a system that is legally required to put the child first. No updates, no timelines, no communication. The request entered a black hole. The gap between what children need and what they receive is why we're all here today. I want to touch on 3 core problems, which we hear from our frontline members. Significant administrative burdens, delayed or missing payments for services already delivered, and Jordan's principal being asked to compensate for failures elsewhere in the system. Occupational therapists make daily life workable at home, at school, and in the community. For many children, that means support for autism, developmental delays, sensory differences, or challenges with emotional regulation. We help with everyday activities like bathing safely, getting ready for school, or managing routines. When these supports are in place, we see real outcomes: safer homes, better school participation, reduced family stress, and fewer crises in emergency rooms. But we can't do this work when the system fails. Jordan's principle is not a nice to have. It is a legally enforceable child-first obligation rooted in Canadian Human Rights Tribunal rulings and the TRC calls to action number 18 and 19. First Nations children must receive timely access to services, with governments resolving jurisdictional issues later. And we're not meeting that standard. One core problem is that Jordan's principle has become a catch-all because our other systems are failing. The non-insured health benefits program was meant to cover essential health services, but it does not reliably cover many occupational therapy services First Nations children need. When NIHB doesn't cover a service, families turn to Jordan's principle. When Jordan's principle delays, there is nowhere else to go. The need doesn't disappear. It surfaces later in emergency rooms, school disruptions, and family crises. That is how Jordan's principle became the default rather than the safeguard. And when policy changes are made without adequate transition time, they cause exactly what Jordan's principle was designed to prevent: service disruptions and gaps in care. This is not about a few complex cases. As of February 2025, Jordan's principle had nearly 135,000 backlogged requests, including about 10,000 pending intake and roughly 8,000 marked urgent. That's not a drift, it's a standing failure. Many of you have read headlines about Jordan's principle funds being used for headshots or ATVs. Let me be perfectly clear. First Nations families did not approve these requests. The federal government did. It is unfair to punish children needing a safety bed today because the government's administrative errors yesterday. If government is concerned about sustainability and accountability, it should listen to its own internal audit. Indigenous Services Canada describes the current approach as unsustainable and calls for stronger controls and clearer criteria, not blanket slowdowns that delay essential care. A system that exhausts its workforce cannot care. Occupational therapists want to work with First Nations communities and children, but ongoing barriers are exhausting the workforce. We're seeing denials based on misunderstandings of OT scope, including claims that OTs don't do mental health work, ignoring our role in trauma and regulation. And most critically, we're seeing delayed payments. Occupational therapists are putting their own money on the line, waiting 9 to 18 months for reimbursement. As one member told us, I will likely not get paid for 6 to 12 months. It is unfeasible for me to continue to accept these referrals. These delays are most severe in northern, rural, and remote First Nations communities, where workforce shortages already exist. Providers report losing entire school-based occupational therapy positions due to funding disruptions, leaving children without any local services for the school year. When providers burn out, children lose continuity of care, families are forced to start over or go without, and the backlog grows. We are calling on the federal government to urgently do 3 things. Fix the machinery, enforce service standards, 10 days for decisions, 30 days for payments. Families deserve the same accountability and the government demands from taxpayers. Stop the NIHB shuffle. Fix the failures in the non-insured health benefits program that forced children into the Jordan's Principle queue in the first place, turning what was meant to be a safeguard into the default. Consult rights holders and the front lines. Meaningfully engage Indigenous rights holders and communities, and include service providers in designing and implementing reforms. That means not just consultation, but embedding clinical advisors within government to help streamline requests and clear the current bottleneck. We know where the problems are because we stare at them every day. This is not just about invoices. 10 years after the TRC, only 14 to 15% of the 94 calls to action have been fully completed. By failing to fix this backlog, the government is failing its commitment to reconciliation. One therapist summed it up best. Jordan's Principle is life-changing when it works and negligence when it doesn't. Children like Maya cannot wait.
Good morning, and thank you for joining us today. My name is Luciana Nekita, and I'm the Chief Executive Officer for Speech, Language, and Audiology Canada. We represent over 7,000 speech-language pathologists, audiologists, and communication health assistants working across Canada, including the First Nation community. Speech-language pathology and audiology services are essential health services under Jordan's Principle. They support children's ability to communicate, learn, participate in school and in their communities, and connect with their families. When access to these services is delayed or denied, the consequences are immediate and can be lifelong. We strongly support Jordan's Principle and its child-first intent, but our concern is how the program is being administered in practice. Like our partners in occupational therapy, our members are seeing firsthand how administrative barriers within Jordan Principle are preventing children from receiving care when they need it. Complex application processes, inconsistent decision-making, delayed approvals, and reimbursement backlogs are creating uncertainties for families and making it increasingly difficult for providers to sustain delivering services in communities that need them the most. For children who need speech and hearing support, delays matter. Missed early intervention can affect language development, literacy, mental health, educational outcomes, and long-term well-being. These are not optional supports, they are foundational for healthy development. In First Nations communities, this work goes beyond individual services. It includes traveling to remote regions, coordinating care locally, and supporting families as they navigate systems that have not consistently met their needs. Services remain inequitable. particularly in northern rural and remote communities where healthcare workforces shortages are already acute. Geography, travel requirements, and limited local services continue to create barriers that Jordan's principle was designed to overcome. Jordan's principle was created to put the child first and to ensure jurisdictional and funding disputes are resolved after services are provided, and not at the expense of children and families. That is not what we're seeing today. SAC is calling on the federal government to urgently address the systemic barriers within Jordan's principle so communication health professionals can do what they're trained to do, provide timely and effective care. This includes streamlining administrative processes, supporting Indigenous-led initiatives, and expanding virtual and mobile service delivery models that work in remote communities. It also means supporting health authorities, tribal councils, and Indigenous partners to coordinate service locally and ensuring Indigenous voices and frontline providers are meaningfully involved in decisions about care. We echo the Canadian Association of Occupational Therapy's call for meaningful engagement within the frontline healthcare providers as reforms to Jordan's principle are developed. Our members bring critical expertise and practical solutions that must inform any path forward. Children cannot wait for systems to catch up, and the healthcare workforce cannot sustain a system that asks them to absorb the consequences of administrative failure. We look forward to working with our Indigenous partners, allied health organizations, and federal government to ensure Jordan's principle truly delivers on its promise for every child in every community. Thank you.